Hi guys, welcome back to Let's Go Mental. My name is Warime. Now, in today's video, I have my very good friend here, Sandra. We've been friends for very many years since we were kids.
Yes. Hi, guys.
Yeah, so Sandra is a psychologist and she mainly treats kids. So I thought it's important for her just to come and share with us about teen depression and what to look out for and yeah, stuff like that. So thanks for
Alright.
coming, my dear.
Great. Thanks
Yeah.
for having me. It's nice to be here and talk about this.
Yeah.
Yeah.
Okay, cool. So maybe you can just introduce yourself now properly.
All
And
right.
then, yeah.
My name is Sandra Githaga, and as Waremi said, we've been friends since I think we were 14 years old. And I am a counseling psychologist by profession. I specialize with children and adolescents, and my background is trauma, more with children who have been traumatized by their worlds. And I'm really excited to be here today to talk a bit about depression and also depression with children.
Okay.
So thanks for having me.
Oh, you're welcome. So I guess we can get straight right into it. I'd asked
Okay.
a few people some questions they'd like to know about kids and depression and all that.
All right.
So the first question that I got is what is teen depression?
Okay.
Yeah.
Okay. I think that's a good place to start. And when we look at depression, I think for me, it's looking at, we all get sad. So all of us get sad once in a while, and we are able to recover from those moments of sadness, and we use our own coping skills. However, when it comes to depression, it's a long-term feeling of sadness and hopelessness, which affects how we function in whether it's in our social life, our school, our physical abilities also. So it's more sadness over a long term and interfering with how you function.
Okay.
Yes.
Okay. Cool. So, and okay, right now in Kenya, probably maybe, I don't know if there are any statistics in terms of teen depression, like how prevalent is it? And even if it's not in Kenya, based on your experience or what you've read globally,
Yes.
yeah, how prevalent it is in teens.
Okay, I haven't read any statistics on Kenya as yet, though looking up at research that has been done in more Canada and America, they say that 4% of teens would be faced with depression.
Okay.
Yeah, so that's actually a high number.
Yeah.
And even when we look at the stories that are currently in the media, you do have a number of cases of depression being talked about in the media, and also, unfortunately, deaths by suicide that have been shown with regards to children.
To children.
Yes.
Okay.
Yeah.
Okay, cool. So now maybe you can just tell us who is at risk as a teenager, who is at risk of getting depression, or what are the triggers of depression?
Okay, all right.
Yeah.
Okay, when we look at depression, so there's basically two things that would make someone at risk of depression. One is environmental, and secondly is genetic factors. So what that means is, if we can start with genetic.
Yeah.
If you have a relative, close relative of yours who has been diagnosed with depression, you're more likely to get depressed.
Yeah.
Okay. And then the other aspect is looking at environmental factors. So when we look at environmental factors, is what is surrounding this teen and what can lead them to feel depressed. So this could be issues like low self-esteem, divorce of family issues, whether it's divorce, separation, abuse, even looking at things like long-term bullying of the child, not feeling like they even exactly fit in.
Yeah.
These can be some of the factors that can put a child at risk to
Okay.
get depression.
Okay.
Yes.
Okay, cool. So what are some of the symptoms that a parent can look out for, or a family member? Because you see, it's not only, doesn't only have to be the parent, but it can
Yes.
also be, you know, maybe the siblings,
Yes.
the aunties, uncles. I mean, what symptoms should people look out for?
Okay.
Yeah.
I think one of the things when we look at depression, like I started with earlier, is this feeling of sadness. So depression is first really intense feeling of sadness that comes with hopelessness and helplessness. So what I mean by hopelessness is that a teenager may feel like there's no hope in the future. Helplessness, meaning nobody can help me get out of this situation. There's also issues to do with the way they are. We've talked about the feeling and looking at things like the thoughts that they have. They may have a lot of negative thoughts. A lot of negative thoughts about their current situation, about the future, and that those are things that we would challenge now in therapy. Also looking at issues in school, and this can look at a child was maybe doing really well in school, their grades were good, and then all of a sudden they drop, they keep getting lower. That could also be another symptom. Also looking at withdrawal, so they may withdraw from the social groups that they were in, even if it's just like family, friends, they withdraw. They prefer to do a lot of things on their own. That could be another symptom of depression. Then also poor concentration. So finding that because of these feelings of depression, these thoughts, negative thoughts, it's harder to concentrate on various things. And this is where sometimes I often think, when you have parents saying my child is not concentrating, to kind of rule out all these things, because often we like to think towards things like illnesses like ADHD, but it's to look at, can we look at a more broader aspect so that we're able to narrow down that we've excluded ADHD and other illnesses, and we can say it's depression. Yes. And I would also say like even just physical symptoms, especially with children, because children lack the vocabulary for feeling words. So you may find that they would more likely internalize the way that they're feeling. So you'd see them having more symptoms like frequent tummy aches with no general medical condition being diagnosed. Tummy aches, chest pain, difficulty breathing, so a number, and difficulty breathing, headaches. And when we look at difficulty breathing, we also bring an aspect of anxiety now, things like that. So there would be a lot of, and this is what we call psychosomatic. So the body is expressing the feelings that they are finding difficult to verbalize and put into words. Yes.
Okay. So, I mean, now having explained to us the symptoms, now we know now usually when teens get to a certain age, they become difficult, throwing tantrums. How can a parent know or gauge what's the difference between the two? And how can a parent now address that once they notice that the kids are experiencing certain symptoms? And
I think that's a really good question, because often when you have a teenager who's depressed, they'll be brushed off, or this is just teenage moodiness, or they're not being obedient, they're being disrespectful, because you may also see some of these kids with depression who have now they externalize, and it becomes anger outbursts and things like this. So often when we look at the difference between normal feeling of sadness or now an aspect of depression, it's to look at the frequency, the frequency being it's happening for a long period of time, and they're not able to function in different areas. That's what I would say would be a trigger for me that it could be depression.
So pretty much what you're saying is that as a parent or as a relative to this child, they need to now start separating, probably first of all, the emotions in terms of this child is just being difficult, and probably think deeper and say, okay, fine, probably this child has a deeper problem than just the teenage tantrums.
It's a really good point you bring, because the way we were parented is different from how we would parent the generation now. And you're totally right in saying I'm the adult, listen to me, follow my instructions. But now it's to have more conversations with these children. They have so much more influence, things to make them feel sad about to a point of depressed, as opposed to us. We didn't have like social media, we didn't have cyberbullying, we didn't have we're gonna go to a party this weekend and all of us post it on Facebook and then make it clear you are not invited, put a status about you, Snapchat it. So there's so much influence more than before for us. So I think it's just looking at how can we talk to the children even ourselves, it's a bit scary. If that's not how you've grown up, you may find it difficult to do that.
Yeah.
And this is something that our therapist can help you with. What games and activities are there to address feelings, have these discussions on a regular basis, so that it becomes comfortable, and that you do it with a child on a regular basis.
So now that you've mentioned a therapist, what are the treatment options that a parent can look at?
Okay. When it comes to treatment options for depression, I would say there's two main broad ones. The first one would be a therapist, and the second one can be a medical doctor. I really would like to, I often share this with a number of the clients that I see. So when it comes to a therapist, in our profession, it's okay to ask us what our experience is. If we've dealt with depression, or what our experiences, how many children, what our specialization is it children, is it adults, so that you can also have that confidence that we are able to see that child. And a lot of the times, and I'm sorry to say this, in Kenya we often will go first to a medical doctor or a psychiatrist for support in areas like this, though it should work the other way around, in terms of where you first see a therapist, are able to talk to them, address some of these feelings, thoughts, and if the therapist feels that you need medication, they would refer to a psychiatrist. I often refer to psychiatrists when I feel that medication would be helpful to the child that I'm seeing. Though if it's something that can be treated just with psychotherapy, I would prefer the psychotherapy option, and so would a number of the clients that we see. Yes.
Yeah, of course, that's actually very important, because as a parent, you would not want your child now to start taking medication and at such a young age.
Yes.
So it's and in fact, even that is why it's important for the parent, if you identify these symptoms early, it is important to get the child treatment early.
Yes.
Because now it means that they will not have to get to a point of having to be on medication.
True.
Yeah.
And I think that's something I totally agree, and I always keep telling people that early intervention is the key. So even just this talking with your kids from a young age of, how was your day? Was anyone mean to you? Is there a moment you felt proud? Is there a moment you felt embarrassed? Having those conversations from when they're so young can actually help a child feel that they can talk about these things. It's okay to talk about these things. And if you notice that there's, some questions are a bit of concern, you can also have early intervention in terms of who can my child talk to get further support and address these issues before now we go to the result of using medication.
Yeah. Now we need to address a very, I could say, painful issue. This is the thing of teenage suicide.
Yes.
We know of late there's been a lot of talk on the media, a lot of reporting of teen suicide, and maybe you can just address that a bit. Yeah.
I think for me, one of the things I would like to start off with is what the definition of suicide is. And suicide is the deliberate act of killing yourself. And it is a very, very sensitive topic. And even for us therapists, when we have a child who says that they're feeling suicidal, it's something that we really want to put a lot of investment to be able to help this child. I think it was like 2 weeks ago, there was a story of a boy in Machakos who died by suicide because he was afraid of what he would get in trouble for something he had done. And it broke my heart because there's a lot of children at the moment who are saying that they're feeling suicidal. And often as parents or adults will say that, this child is just seeking attention and things like that. However, even this, just mentioning or talking about it is a risk factor for suicide. So it's to look at, how do you support a child like this? What are you feeling suicidal about? Not validating the thought of having, wanting to die by suicide, but more of, how can we address these difficult feelings, thoughts that you're having, so that we can prevent the suicide from being completed. And if you listen to what I'm saying also, I'm not using words of committing suicide, because suicide is a criminal offense. And as mental health professionals, a lot of us are looking at how can suicide be decriminalized, because when someone thinks about suicide, it's more they want to escape these deep feelings that they're experiencing. It's not they're not looking at, oh, I want to die, but more of this deep pain that they're feeling. And that's why we look at it in terms of how can we help them deal with that. Okay. And one of the things that's also a bit concerning nowadays is, if we don't talk to our kids, we look at, for instance, I think we all watch Netflix, right?
Yeah.
And on Netflix right now, there is the series 13 Reasons Why. The challenging thing about letting your child watch that show, unsupervised, because I think they should be, depending on the age and depending on the parents, there should be restrictions. But the challenge about a child watching it alone is the child will feel, okay, Hannah did die by suicide, and it's okay to die by suicide. And that's fine. And we've also had a number of stories of suicides of children in school at the moment. And with children, suicide is contagious.
Oh.
Yes, and that's why even in the past in the refugee camps that I've worked, when there was a death by suicide, we actually had psychological first aid sessions. So we addressed it. We gave these kids coping skills that they can use, addressing how they feel about the loss of one of their own, so that we can prevent a suicide from happening. And that's why you'll see, and I think also it applies to adults nowadays. There's no research about that, but even when we look at in Hollywood what has happened, like in the past I think the past year, there's been a lot of deaths because there is this aspect of suicide contagion. That once it happens, it shows someone else, this person, it was the end result and they couldn't get help. So even me, I feel like I can't get help and I'll do it.
I've actually never known that.
Yes. So, and that's why when a child says it, it's for us. For us, we view it as an emergency. When a child says they're feeling suicidal, you actually drop everything you're doing and are like, how can you support this child? How can you support the family in getting to understand what's happening, making a safety plan with them, so that we can really support this child. Yes.
Okay. Wow. Actually, I'm feeling, I don't know what you call it. I'm actually feeling sad.
Oh, shame. Why?
Because I didn't know that there's something called suicide
Contagion. Yes, there is suicide contagion, and unfortunately, it's there.
And then now you see with the age of social media, I mean, the kids will, probably if it was in our time, maybe you just know about that child in your school.
And you don't know even the reason why.
Yeah, you don't even know the reason why. But now everyone will be talking about it. All the kids will talk about it. So another child who's struggling with that.
And feeling that way will be like, okay, so even me, this can be my end result.
Wow.
Yes.
Okay.
And it's scary. It's I think it's such a scary time we live in because of all this exposure. But then also we can't also restrict our kids, because once they leave the house, they're gonna be able to, and that's why conversation really matters. So if you decide your child can watch 13 Reasons Why, have a chat with them. What happened to Hannah? How can you what would you do differently if you're in Hannah's position? What should she do differently? Who's a trusted adult she can talk to, just so that it can be addressed? I'm not saying don't let them watch it, please, but more of how can you address it if they do watch it.
And whatever other show
whatever other shows they're watching. So because we just have to be there has to be much more conversation than before. Yes.
Okay. So when you said that you treat it as an emergency, what treatment do you...
Okay, so
what steps do you take?
All right, so it really depends, and we have to, when there's an aspect of suicide, we have to look at the risk, and this is by finding out, is there a plan, do they have a well thought of plan of how they're going to do it, where they're going to do it, what time, are they talking about it, either by writing? Is there a note that has been found? Have they mentioned it to someone? So looking at all those things. I personally prefer when a child says they're suicidal, that there's at least 24-hour hospitalization, so that they're observed. Because as stressful as it can be for any parent or even sibling or anyone, when you hear that a loved one is suicidal, it's hard to understand.
Yeah.
It's very hard to understand, and often you hear people saying, but I've given this child everything.
Yes,
You're like,
actually, I've had that before.
yes, and you're like, it's not about that.
What
it's
you've
more
given
of
them.
this pain that someone is feeling.
Yeah.
So it's to look at how can you support this child the way they are right now. So that's why it's really good to do the hospitalization,
Yeah.
because then they can be observed. The family can also get some therapy.
Yeah.
They have joint therapy sessions together. If a lot of the times there is a need for a psychiatrist to do an assessment at this stage,
Yeah.
and then also for the psychiatrist to may prescribe medication if they deem necessary, because that's not us who dictate. It's
Yeah.
now them and their profession to dictate whether, after the assessment, see if a child needs medication. So that is my preference. So often, if I do have a child who is suicidal, I often refer to a psychiatrist for assessment and possibly admission.
Yeah.
And then they would have the medication and at the same time therapy from where the hospital that they're in. And then when they come back, I continue therapy
The
with
therapy
them.
sessions.
Yes.
So thanks, Sandra. I've really learned a lot. Honestly, there's so much that I didn't know about. So what's one last thing that you'd like to tell the teenagers, tell the parents of anyone who's experiencing these issues?
Okay.
Yeah.
I think for me, one of the main things I would like to say, especially as someone coming back into Kenya and seeing still how there's such huge mental health stigma, is that there's help available. There's so much help available. There's such a large network of mental health professionals, both psychologists and psychiatrists, that are available to help. And once we are approached to help, we're often very supportive, keen, offering family sessions, individual sessions, to ensure that whoever is feeling, whoever has the suicidal ideation or past attempts or present can actually get support and recover.
Yeah.
So there's always help available, and there's always an aspect of recovery.
Yes.
Yes.
Okay.
Yes.
Cool. Thanks, Sandra, for
You're welcome.
joining us.
Thanks for having me.
You're welcome. Guys, I really hope you've learned a lot as much as I have. And if you have any questions, please put them down in the comment section below. I'm sure, Sandra, you'll be coming for another episode.
Definitely. I'll do that. Definitely.
So yeah, please put down any questions that you have. We shall be addressing them in any future video when she joins us again. And guys, do not forget to subscribe, comments below as I've mentioned, and we shall see you in my next video.